90% of the symptoms in the body are from the physiology, and only 10% are structural. Whereas in medicine right now, we're working about 90% structural, and we're really hurting people. So I was finally seeing 3 to 5 patients a week. Again, not Dr. Death, but not that far off, where they're having these big operations done with complications that were destroying their lives. And I just heard of one case this weekend from the East Coast. I did not see the patient personally, but 2 of my friends were trying to salvage her situation. She's 26 years old with a normal 26-year-old spine. Some surgeon decided to fuse it from her skull to her pelvis.
Whoa.
26 years old. And we know that pain and the back pain and neck pain, we'll talk about this a little bit later in the show, is in the muscles, the tendons, the ligaments. And there's nothing in medicine, in our anatomy, any part of our training that says taking a normal spine and creating this mass of scar tissue and bone with rods in place makes any sense at all. There's no data to support even a 1-level fusion for back pain. So the success rate of a 1-level fusion for back pain is about 22%.
When you say 1 level, that's just fusing 2 vertebrae together?
Correct. Welding 2 vertebrae together. So what a fusion is, we create a temporary bridge with screws in place to hold it still. And then the body, we lay in bone graft, which forms a bridge of bone between the 2 vertebrae, which makes a solid piece of bone. So if the bone doesn't heal, the hardware will eventually break. So the hardware is temporary because bone will not form if there's motion. So we're very good at obtaining fusions. But remember, bone spurs, arthritis, disc degeneration, herniated disc, bulging disc, none of those are a source of pain. They've been well documented to not be a source of pain. So the better terms that are being degenerative disc disease would be a normally aging spine. So we're doing over $20 billion a year of spine surgery on normally aging spines.
And how many people does that represent?
Over 500,000 a year. So I estimate over the last 10 years, we have over 5 million people with operations that have about a 20 to 30% success rate. So if you're one of those people that got better, great, I'm excited for you. But remember, the placebo response, which is actually a very powerful healing response, is about 20 to 40%. So this is actually worse than placebo. And if you use tools that honor the body's physiology, you heal. People heal. So this 26-year-old girl could have easily, classically, done just fine and had a normal life. So now she's like a tree. She can't tilt her chin. She can't rotate her head. Her neck is welded to her pelvis. And then on top of that, in her neck, what happens is that it's called internal wound dehiscence. So it's called the fascial layer is actually pulled apart. The skin, she has a big concavity in the back of her neck. And so now, in addition, she has a web neck.
What does that mean?
So the skin gets plastered to the spine. So there's sort of like a hole in the back of her neck. I mean, there's skin that covers it, but there's no muscles or tissues over this spine. So then the tissues on the side of her neck pulled out to the side. And so the muscles are on the side of her neck. It's like a web. It's like a web feet. So she's 26.
That's tragic.
And somebody, but see what happened, instead of doing 1 and 2 level fusions that didn't work, I'm now seeing 8, 10, 12, 14 level fusions that don't work. And the complication rate of these operations is horrendous, over 70%. The success rate is 20% or less. Then what finally got me to quit is that I was seeing patients, dozens and dozens, now actually hundreds of patients go to pain-free with minimal risk, minimal cost, self-directed. So I'm watching these people go to pain-free, and I'm watching people actively being hurt with spine surgery. And then the downside of a failed spine surgery is just catastrophic a lot of the time. So again, the success rate of doing a back fusion for back pain is about 22%. There's not one research paper in 60 years that says that a spine surgery works. Not one.
Thanks for watching. If you like what you just saw, why not subscribe? Here's a link to do that. And if you'd like to watch the full interview, you can find it at chrisbeatcancer.com. There's a link to it in the description right below this video.